Since its launch, the crisis number 988 has aimed to address the need for mental health and suicide prevention services. And now we are getting a closer look at the impact in Georgia. Here's 11 Alive's Kara Spelger.
In its first 45 days, the 988 hotline has already seen a high volume of calls and texts in Georgia.
It's a variety of reasons why somebody calls. I mean, we're seeing it all. Some people are, at risk of, dying by suicide, and we see those calls. But we also see somebody calling who is in need of an outpatient appointment.
Preliminary data from the Georgia Department of Behavioral Health and Disabilities shows calls were answered every 7.4 seconds within the first 45 days of 988's launch.
Because it's also a mental health crisis line. You don't have to be at risk of dying by suicide to call this number.
And a big need is in rural areas. The 5 counties with the greatest prevalence in crisis calls are Webster, Dougherty, Baker, Lowndes, and Early counties. Paige Gaines, the founder of 911 St. Jane's, says a lot of this has to do with access to resources.
So if you're having a crisis and you're waiting for somebody to come in, it could take just a little bit of time longer than it would be if we're in the cities.
The data also shows around 10% of those reaching out were under the age of 18. But Paige says there's an upside to this statistic.
The technology is now there to meet that need. So we're having these teens reach out the best way they know how. That's a positive thing. You're giving them that outlet. You're giving them that resource directly where it should be.
Moving forward, she says she wants to see more people aware of the hotline and its ability to connect people with resources. Kara Spelger, 11 Alive News.